man, we are live at HIMSS in Vegas, and it's great to have you here. Christopher, you want to introduce yourself real quick?
Yeah, Chris Cruttenden with Safety Net, president and founder. Our specialty is providing specialty care access for the underserved populations. And Jomo, you want to introduce yourself?
Jomo Kenneth Starke. I'm a senior advisor for Safety Net Connect.
Wonderful. Well, I had the privilege actually of interviewing Chris about a week or so ago at another conference. So he and I had a very lively discussion. So I'm glad we could reconnect again here at HIMSS and extend the conversation to with Jomo as well, and my colleague Michael too. So why don't you spend a couple of minutes sharing again your story, your journey, both of you. How did you guys come together? And then a little bit more about the company and its purpose.
I wish I could say we were geniuses and we came up with this idea to provide what we call e-consult, ASIC, we're the smart forward access specialist. But I saw a presentation from Dr. Yi from San Francisco. I thought it was really great. Thought we could do it better, and we implemented it for free for a few FQHCs, and eventually LA County and LA Care adopted it for this county-wide program to basically decompress these highly utilized specialties. And at the time, before we came in there, the wait times, GI 200 days, cardiology, 150 days. Patients were just going to the ER.
Right.
And since we've come in, we've knocked down wait times to a day. And now it's a best practice when and if they need to be seen in face-to-face situation. But most of these, what I call street referrals or consults, can be resolved in the care of the specialists.
No, that's great.
Excited.
Absolutely.
Did you want to add anything to that?
Yeah, no, no. So you asked how it came to these guys' circle. So
Right.
I've been. I used to be head of something called Cinemed Labs. Cinemed was a for-profit Medicaid services company. Had a competing product in the same market in LA for our capitated docs.
Right.
And we could control them because they were basically on our cap and in our system. And I heard about this company kind of doing this in the wild in LA. So I've been stalking these guys basically for 15 years.
Right.
And I just met his partner Keith about 6 months ago on a call through another bunch of connections. And so yeah, I've just been, I kind of hit the ground running and kind of knowing what they're doing and helping them figure out what all those things are worth, right? How much of those ER avoidances are
Absolutely.
worth to the county.
Absolutely. And how important is that today? I mean, post-COVID, right? When you look at what hospitals and health systems are struggling with, it's all around revenue capture, right? And the challenges that exist there. And so talk a little bit about how your technology might be helping to support that in any way, or addressing some of the issues related to the post-COVID environment now.
Yeah, it's really interesting. COVID, for a lot of telehealth groups, their companies took off.
Right.
Peloton,
Right.
a few others, just exploded. In our situation with the underserved and managed care, all care originates in the primary care office.
That's right.
It's really a tuned center of health. They were told not to see their doctors. They were told not to leave their house.
Oh, interesting.
And for a year and a half, we saw our patients referral rates, consult rates go from 20,000 a month to 1,000.
Wow.
And because of that, we saw a lot of patients that really had some bad issues.
Exactly.
If they're diabetic, they had some ulcers that really should have been addressed. Heart issues, A1Cs were through the roof, and there was a myriad of things that we saw. Now it's back to where it is, and patients are getting care.
Right.
So yeah, post-COVID for us, thank goodness.
Right.
It's really helped the patients, but also for the value-based idea. Now that patients can kind of adopt a few things, originate in a primary care office, which is really great. Consultation between the PCP and the specialist, but then if it does need to be in a situation where they can use video or face-to-face with a specialist,
Exactly.
it's streamlined. They don't have to travel. So all those pieces now really work together nicely versus prior to COVID, it was a lot more storm forward, zero video, nobody felt comfortable with it. Now everybody feels comfortable with video, and the storm forward and video together created a lot of value. I think more for the patients, than
Exactly.
the health systems. Go ahead, sir.
So it seems like this is the way healthcare should work. It doesn't. Is the problem mostly the reimbursement that doesn't make this work? And you were right now in the LA area. I mean, I don't know why this wouldn't be in all 50 states, regardless of whether it's rural or access to care. It just seems like it's so hard to see a specialist, so hard to get, whether it's
Yes.
my mom or dad.
Exactly.
care.
Mayor, do you want to talk about
Sure. Yeah. This is access is a universal problem, and particularly safety net access.
Mhm.
Right. Be it inner city, be it rural.
Right.
They're different challenges, but they both have challenges. Right.
Right.
So yeah, I don't know why it's not in all 50 states either. Right.
Right.
But the answer to your question, it's a multi-part answer. It is reimbursement. It's laws. It's monopolies. It's right. It's the different way that healthcare is delivered in different states, and we don't always gravitate toward the things that are good for the system right away. Right.
Sure.
And so, yeah, I think it's just, and I think some of the work we've been doing really is to help people understand that value.
Right.
Right. And really putting a number to what that means when you do 200,000 consults and you basically provide care in a day versus 9 to 12 months. It was actually worse than that. So when I was at CenterMed in 2010, the wait time for a dermatologist was 16 months in
Wow.
LA.
That's
Right.
insane.
So imagine you've got a cancerous mole and you have to wait 16 months
Right.
to
Yes.
get your
Oh,
first
yeah.
appointment. Right?
Absolutely. Could have been metastasized by then. Yeah.
Totally.
That-
Totally. So, yeah, no, I think it's, again, the political environment is challenging with Medicaid
Mhm.
and such, but I believe that technologies like these that improve access, demonstrate value, patients love it, doctors love it, it helps the system. Like there's no losers. It's so much of healthcare, one person's, revenue reduction is another person's revenue increase, right?
Exactly.
And so this is a really unique situation in which there's really no losers,
Right.
right? So it's very exciting.
No, that's great. You touched on something too. I want you to maybe expound on it a little bit. We always talk about social determinants of health, but there's also the concept of political determinants of health,
Yeah.
right? So talk to us a little bit about, you mentioned about Medicare and Medicaid and, the new administration potentially, how that might impact what's happening in this value-based care. Just curious, give us your opinions and perspective on the impact that, this new administration might have on addressing the underserved communities and how your technology may even support
we have a
closing
little-
some of those gaps.
we have a little fear and uncertainty. about
Yes,
the flood.
right.
I will say the CMS grants, CMMI innovation, not just for stuff that we do, is really amazing. And
Right.
and not everything works, but you got to trust it.
Sure.
You have to incentivize. And the value that's created with systems like an eConsult through those programs that allow states, for example, state of Colorado,
Right.
to drop a program that may be prohibitive financially, it is something that this new administration needs to look at the total value as opposed to having a 20-year-old look at a bottom line number and say, oh, well, cut that.
Right.
They don't know what happened. They
Exactly.
don't know that patients have to drive 2 hours to see specialists. Why would you cut some telehealth program
Right.
for them? Or that they've been waiting 6 months to see somebody. And this program allows that to happen immediately.
Exactly.
So yeah, I think if they saw the value and they saw some of the white papers we've created on it,
Sure.
they would absolutely keep it.
Absolutely.
Who's going to communicate that?
Right. It's a challenge.
Is a 20-year-old genius going to understand that?
Right. Right. Good point. Good point. So if you could wave a magic wand and change anything about the current system, what would that be?
You go first.
Just one thing.
Full reimbursement for telehealth services.
That's a good one.
Pay everybody. The system works, the access works, patients love it, doctors love it, pay everybody.
Right.
I would even add the patients into it.
Yeah,
As
pay
a
the patient.
reimbursement.
Yeah.
Incentivize them.
It's good.
Participate.
Right.
Participate on all levels And some of the technologies we saw at Vive, where they can send a test
Right.
now, it's amazing. So you could do a telehealth consult and say, hey, you need to do this blood test. They can actually send it to you.
Exactly.
Or a urine test or a stool sample.
Right.
And then it goes back to the doctor. You don't even have to leave your house.
Wonderful.
Yeah, I mean, to me, again, it feels like that's what healthcare should be at this point. If you could, like Netflix used to be, where you had to order it and wait for you to get, but no, you just press a button now. I mean, that's really Amazon healthcare.
We're in a push button economy, right?
That's right.
Literally everything you can get in a
Exactly.
push button. And I won't go to urgent care if I can't make an appointment now.
Right. Right.
Right? I'm not going to go and take my sick kid and
Sure.
sit in an urgent care for
Yeah.
an hour, 3 hours,
That's
whatever. Like I won't. But I find the urgent cares where I can make an appointment.
There you go.
So I mean, we'll figure it out, and we have to figure it out.
So what are you looking to get out of this year's 2025 HIMSS conference, global conference?
I'm just riding the AI tidal wave.
Are we all, right?
It's just like
Yes.
every few weeks,
Yes.
like my mind gets blown by
Right.
something I didn't know I needed to know,
Right.
or some new whatchamacallit, that does something amazing. Like it's just a constant stream, and just from Vive to here, they're
Right.
doing, I mean, you know, the Dragon Copilot stuff that
Absolutely.
just launched, right? I
Yes.
mean, that's exciting stuff. And that ambient scribe, that was the big thing of Vive, and was the ambient scribe, right? And it really just, that wasn't really even a thing a year ago, right? And all of a sudden it's table stakes.
That's right.
Right. No,
absolutely.
physicians don't want to ever type again.
That's right. Exactly.
Right. They want to go back to where they do and just talking into their dictation device
Exactly.
or their iPhone.
Yeah. For me, what I'm hoping to see is a lot of these AI technologies are pretty exciting, but they're kind of modern.
Right.
And even a very little difference between what they can do, at least from vendor to vendor. I'd like to see somebody really start to come up with a marketplace, like an e-consult solution. So you have access
Interesting.
to specialists.
Right.
You have access to SDOH needs. You have access to certain AI technologies. that
Right.
Maybe do the best, radiology reading or whatnot.
Sure.
And I haven't really seen that. Everybody's a little proprietary with it, but all these AI companies can't be a company.
That's right. And some of them are not going to survive. That's the reality of it as well too.
So you're alluding, Chris, to like scaling and which are going to survive. I'd love to think what you guys are doing. It's in California. When will you come to Virginia? You got a friend here in Virginia.
Absolutely. And Georgia. Absolutely. Yes.
Family out there.
There you go.
Count us in. We're working with Senna, and they have some big plans for us. Give us
That's great. Well, Sena's definitely one of our friends and
Yeah.
good people to work with.
Indeed.
All right.
Well, thank you. Enjoy the rest of the conference.
Hey, appreciate
Thanks
you.
for coming
Thanks,
by.
man. Thank you.
Good to see you again.